All right. So nursing. The focus of nursing is on human responses to actual or potential health problems and advocacy for various clients. Sorry. So we talked about what that meant. Nurses have to possess certain skills. So we need technical skills to manage equipment and perform procedures, right? Like putting in an IV. Just because you're a nurse doesn't mean you automatically know how to put one in. We put in chest tubes. We manage dialysis machines. There's technical skill involved in our job all the time. Using a lift, programming a pump, and then, not even just machine-wise, but skills in transferring a patient, giving somebody a bath, making a bed. Oh my goodness, who here, I'm raising my hand right now, who here spent a semester learning how to make a bed and learning how to wash their hands properly and sweating on how to do it, sweating to take a blood pressure? Oh my gosh, now I laugh and think, gosh, that was my hardest thing that semester, was taking the blood pressure properly. I wish that was the hardest thing I did in the day. Not really, because obviously as nurses we get bored and we want to move up. But anyway, interpersonal skills to interact appropriately with people. Yep, that's a big one. And it's not just with patients, right? Interpersonal skills to interact with everybody in the healthcare field. Learning how to talk with providers, specifically with doctors. I know in this kind of setting, sometimes we kind of like to focus on that adversarial relationship, doctors versus nurses. But it's that interpersonal skill to not see it that way. And then also to talk with the difficult family, with the public, when they personify nurses as sexy little foxes who are there to give you water and sponge baths. It's an interpersonal skill on how to represent ourselves. And then cognitive skills to observe, recognize, collect data, analyze and interpret data, and reach a reasonable conclusion that forms the basis of decision. Okay, this is probably the most important thing right now I want to talk about. So let me repeat that. Nurses must possess the cognitive skills to observe, recognize, and collect data, analyze and interpret data, and reach a reasonable conclusion that forms the basis of a decision. As nurses, we don't just input things and do a bunch of tasks, although it feels like it, and pass a bunch of meds, right? We need to have that nuanced skill to be able to look at trends, to be able to see a patient from the beginning of the shift to the end of the shift, and be able to say to the oncoming nurse, there's something going on, and I'm concerned. I don't know what it is, but I'm concerned. And that nurse will know to keep an eye on them, and we can protect somebody from going down the drain, right? And that is part of informatics, is that ability to get information and filter it and process it through real time, but then look at the big picture and be able to take educated guesses on what to do next and reach reasonable conclusions. So, nursing is an information-intensive profession. We are getting information from every side. Information on the patient's status, on their previous history, on their family dynamic, on the way the provider is going. I mean, the thing is, we don't just have to understand our nursing job. We have to understand where the doctor's coming from too, right? Or the nurse practitioner, the physician assistant. Because if we don't, we can't steer our patient in the right direction. So we are constantly getting flowed with information. You know how, I don't know about any of you, but my husband is not in nursing, and he always laughs because a lot of my friends are nurses, and of course I have non-nursing friends. But anybody who's in an information-intensive profession, I tend to cling to, and that's because it's a kindred spirit who understands that we are constantly analyzing for our job in order to protect people's lives. And so the steps of utilizing information, applying the knowledge to a problem, and acting with wisdom to form the basis of nursing practice, that is what nursing science is. We are constantly computing information in our brain and applying it to a problem, applying it to our daily practice so that we are working within the forum of nursing science. So we acquire data and information in bits and pieces and then transform the information into knowledge. And so right now we're going to break down kind of how our mind works and does that. So what is nursing informatics? One of the most frequently quoted and widely accepted definitions of nursing informatics is that it's a combination of nursing science, information science, and computer science. We'll add cognitive science as well. So, nursing science is the building block of nursing informatics, right? So in this chapter, we're going to focus on nursing science as one of the building blocks of nursing informatics. Although, in this text, we extend the traditional definition of nursing informatics to include cognitive science as one of the building blocks. So let's talk about nursing science, okay? So we use knowledge. Individuals have this amazing ability to manage knowledge. We're learned and honed on how to process knowledge from birth. I mean, that is how we grow and evolve and become mature adults and be able to hold jobs and take care of other people. Or even if, your job is in interior design, it's your ability to understand the aesthetically pleasing piece of somebody's mind. That's how we use our knowledge. And we experience our environment and learn by acquiring, processing, generating, and disseminating knowledge. And that really at its core is nursing science, right? We understand that as humans, in health, in everything they do, as our patients, we experience from our environment. And so based on that, you have to look at the patient and their environment in order to understand what's going on with them. So let's talk about the foundation of the nursing model. All right, we're going to tie the model to nursing science in the practice of nursing informatics. So organizational conceptual framework for text, that's the foundation of the knowledge model. It helps us to explain the ties between nursing science and informatics and knowledge, and informatics is viewed as a tool for founding knowledge. So let me give you a little piece of this. The foundation of knowledge model is also introduced as an organizing conceptual framework, okay? So here's an example. Tom H. is a registered nurse who works in a very busy Metropolitan Hospital emergency room. He has just admitted a 79-year-old man whose wife brought him in because he was having trouble breathing. Tom immediately clips a pulse oximeter to the patient's finger and performs a very quick assessment of the patient's vital signs. He discovers a rapid pulse rate, decreased oxygen saturation level, in addition to the rapid and labored breathing. Tom determines that the patient is not in immediate danger and that he does not require intubation. He focuses his initial attention on easing the labored breathing by elevating the head of bed, initiating oxygen treatment, and hooking the patient up to a heart monitor. Tom continues to assess the patient's breathing status as he performs a head-to-toe assessment of the patient that leads to the nursing diagnosis and additional interventions necessary. And remember, this is oxygen nursing diagnosis. This is the decreased oxygen saturation. And so, as you could see, Tom relied on the immediate data and information. He did a rapid assessment, and then using his wisdom from the past, he was able to determine if this patient needed immediate acute intubation or if he could have triage care so that a slower, more thorough assessment could be conducted. So looking here, foundation of the knowledge model. KA, which is the yellow, knowledge acquisition. KD, which is the blue, knowledge dissemination. KG, knowledge generation, and KP, knowledge processing. Nurses are knowledge workers. We work with information and generating information and knowledge as a product. We're knowledge acquirers. We provide convenient and efficient means of capturing and storing knowledge. We are knowledge users, individuals or groups who benefit from valuable, viable knowledge. Nurses are knowledge engineers, and we design, develop, and implement and maintain ways that people can understand our knowledge. So let's talk a little bit more about, about this foundation of the knowledge model. Okay. So first things first. let's talk about knowledge. Okay, let's go back to Tom, okay? He acquired knowledge in his basic nursing education program, right? And he's continuing to build on that foundation of knowledge by engaging in activities like reading his nursing research and theory articles, but also just being a nurse, right? You get experience every day. He attends continuing education, and he uses his clinical database and clinical practice guidelines. As Tom interacts with his environment, he continues to acquire knowledge that has to be processed. And this processing effort, which we do all the time, helps him redefine and restructure his knowledge base and generate new knowledge. So of course, new graduates, right? You see someone come in rapidly breathing, their pulse ox is low, you might be a little more quick on the draw to call a rapid response. But as you get older, you are able, after your rapid assessment, to determine, hey, he's not in any immediate danger. Let me implement some of the skills that I know from all my past experience, from all my past knowledge acquisition, to take care of this patient and do a more thorough assessment. Tom can then share, which another word is disseminate, the new knowledge with colleagues, and he can get feedback on the knowledge that he shares. That dissemination and feedback loop builds the knowledge foundation again, and Tom acquires more information. He processes, generates, and disseminates even more of this new knowledge, and the feedback loop continues. As others respond to his knowledge dissemination, he acquires yet more knowledge, and he's engaged to rethink, reflect, re-explore. Nursing is a constant learning cycle. I think that's true to say in every job, but especially in healthcare. I apologize. Keep hiccuping. So we talked about nurses as knowledge managers. We capture and process collective expertise and distribute it where it can create the largest benefit. So right now, I'm being a knowledge manager. We're talking about, our collective expertise, and I'm distributing it to you guys through the internet via a lecture. We're knowledge developers or generators. You change and evolve knowledge based on tasks at hand, and then you further disseminate that to other people who can use it. Knowledge viability. This refers to technology-based applications that offer easily accessible, accurate, and timely information obtained from a variety of resources. It also offers methods and presented in a manner as to provide us with the necessary elements to generate knowledge. That's the ability, that's when we know that the knowledge that we're giving is good knowledge because it can be repeated and used and manipulated and reused over and over again. The use of knowledge. All nurses have the opportunity to be involved in the formal dissemination of knowledge via their participation in professional conferences. And we've talked about this. Regardless of your practice arena, you use informatics and technology to inform and support practice. So what do they mean by using wisdom? So wisdom's the application of knowledge to an appropriate situation. Okay, basically, the longer you're in the field, the more information you have, and the better you are at processing and disseminating, and the faster you are, right? In the practice of nursing science, we expect action and/or actions directed by wisdom. If we all just acted based on the instinct that we had as new grads, nurses wouldn't be an integral part of healthcare. It's our experience that matters. Sometimes when people ask, why can a nurse practitioner go and practice without a residency? We're talking about that wisdom, that knowledge base that we have from our nursing experience that helps advanced practice nurses work in the way that they work. And the same as when nurses who are advanced practice nurses but take on more and more roles, the roles of educators. I mean, if any of you, I'm sure there are some of you in roles where you're not just educating other nurses, you're educating other disciplinaries that you don't necessarily have a license in, but because of your wisdom and experience and knowledge base, you're able to educate them and educate them well. In order for nurse educators to be effective, they have to be in the habit of constantly building and rebuilding their foundation of knowledge about nursing science. Look, I am working on my terminal degree, which is, for me, it's a DNP. There's no way that I'm going to say, all right, when I graduate next year, that's it. I don't have to learn anymore. Absolutely not. I'm constantly learning. Learning to be able to teach you guys. And you guys are constantly learning, too, to be able to teach me. Just in my class last semester, the students were blowing me away with these great ideas for me to implement in my practice. nurse researchers have to acquire and process new knowledge, and they design and conduct the research studies. Now, I know sometimes research is kind of like this area of nursing that we like to put on a shelf, like, well, I don't do nursing research, but we do, right? Whether you're an official nurse researcher or not, we're constantly implementing mini research studies, even if it's in our head, and some of them are actually more formal. So we have to understand how to formally acquire and process new knowledge and design and conduct a research study. So nursing in the future of nursing science and nursing informatics is intimately associated with nursing education and nursing research, and we know that. Everything we do is based on evidence-based practice. Every time we want to change something, it's for quality improvement, and we have to prove that it's an effective change, not only to get people to support it, but to get people to actually take ownership of it. I mean, I don't know about you guys, but when I was a new RN and they started talking to us about this whole electronic medical records, oh my goodness, you would think they were asking us to jump off a cliff, but it was this whole scary new change. But as more and more evidence came out about how much better EMR is, and also the evidence that we saw, wow, I can read these doctor's orders, wow, I can see the trends on my flow sheet, wow, it's really hard to make an error when I'm documenting. This is a great thing. We took more ownership, and now EMR is a really integral part of our nursing practice. So informatics and the use of technology in the practice of nursing is equally important in the nursing research arena and in other parts of nursing. And that's what we're going to talk about. So Goosen, who's a nursing informatics advocate, believes that focus on nursing informatics research should be on the structuring and process of patient information and how these inform nursing decisions to make clinical practice. And we're going to talk about that. Okay. So that's it for this section.